So, good evening, guys. So, as per your syllabus, in last class we had discussed about the basics concepts about the chemotherapy. So, in chemotherapy, the first subunit is beta-lactam antibiotics. So, why it's called as beta-lactam antibiotics means, so it's having a beta-lactam ring. So, particularly the 5-member ring and the 6-member lactam ring. So that's the reason it's called as a beta-lactam antibiotics. So in that category, the two important drugs are penicillins and cephalosporins. So apart from that, so the two important categories are penicillins and cephalosporins. So apart from that, two other categories also there, that is monobactam antibiotics and carbapenem antibiotics. So I hope you know this entire story. What is penicillin, where it is found, and when it is found, how it's going to found. All the stories you know that. So I don't want to repeat all those things. So as per your textbooks, these penicillins and cephalosporins are classified based upon different manners. One side you can see here the penicillins are mostly classified based upon the chemistry nature. So first, it's mostly classified based upon the natural penicillin and the semi-synthetic penicillins. So then further they are classified into the drugs based upon their potency. So and based upon the physicochemical properties. So the natural penicillins are benzyl penicillin. Then semi-synthetic derivatives are further classified into different category. The first one is acid-resistant penicillin, because that penicillin is mostly when it's available in when they are found, it's available in injection formulation. Orally it's inactive because it's acid label. When if you are take the drug through oral administration, it may affect with our gastric acid secretion. So to overcome this issue, they have to convert it into semi-synthetic product. They have add some of the basic group, they are converted into the basic nature to resist the acidic condition, to survive in the stomach acidic environment. So through that mechanism, they are converted into the tablet formulation. So for those process, they are converted into the semi-synthetic penicillins. The important drugs are phenoxymethyl penicillin. So the next category, it's a penicillinase resistant penicillin. It's a separate category. So I will explain what is penicillinase enzyme, all those things I will explain. For classification and all, you don't have any other choice. You just muck up. Otherwise, you have to memorize. That's only choice. So in cephalosporins, is mostly classified based upon the generations. First generation drugs are second generation drug and third generation. The generation it means it's a novelty of the drugs. Those who are invented first, those who are the categorized first, that time that's considered as your first generation. So later every decade they have introduced so much novel molecules they are identified in this category. So they are made into the second generation and third generation and fourth generation. So in that category itself, they have drugs has been classified oral formulations, oral available drugs and otherwise parenteral available drugs. So they can classify it based upon different manner. So each and every category, at least you have memorized at least 2 or 3 drugs. Okay. So this is another one classification. So both the things, entire beta-lactam antibiotics, this is separate classification. So in this picture, you can easily know the entire beta-lactam antibiotics, except entire antibiotics, beta-lactam antibiotics. So this is first category, penicillins. Entire classification comes here. In second category, the cephalosporins, it's further divided into the 4th generation. Then carbapenems and monobactams also, they are included in this slide. So for classification, I said clearly, it's very difficult to memorize, very difficult to pronounce, but you don't have any other choice. You just memorize at least any 2 or 3 important drugs from each category or each class. Okay. Yeah. Next, we can come for the some more deeper into the beta-lactam antibiotics. So, why it's termed as a beta-lactam antibiotics means because of it's having beta-lactam ring. The beta-lactam ring is nothing but it's having important, in this ring it's having a important one. This is 5-member lactam ring. This is 6-member lactam ring. So thiazolidine groups and the lactam ring is going to conjoin together. Simply it's called as penicillinic acid. So based upon this lactam ring availability, they have termed as a beta-lactam antibiotics. So here the penicillins are mostly 5-member. It's having 5-member lactam ring. Cephalosporin is having a 6-member lactam ring. This is a key point. So the beta-lactam ring is there. That's the reason it comes under this category. 5-member means penicillins and 6-member means cephalosporins. You can see here. So this is a core molecule for the beta-lactam antibiotics. You can see here both the things, penicillins and cephalosporin. One example from each category. So this is a core molecule. So it's having a beta-lactam ring, 4-member lactam ring. If it another one is thiazolidine ring. The two ring is very essential for the activity of penicillin. If in case any one changes, that means during a resistance case, if breakage of any one of the ring means the penicillins, that means the beta-lactam rings is going to lose their activity. So the both the ring, beta-lactam and thiazolidine is very essential for the activity. Maybe in your medicinal chemistry you have studied in the SAR, structural activity relationship. So based upon this, this is a core molecule. You can't able to change any core. You can't able to change this core molecule. We have choice only to change the substitution in different places. So that's the only choice. Okay. So beta-lactam ring is important. Then thiazolidine ring is important. This is the penicillin case. In cephalosporin, the same thing. Beta-lactam and thiazolidine. Here, 6-member lactam ring is there. That's a difference. Okay. So next we can come for the penicillin. So I have give you a title as a penicillins, but you don't bother about that. The penicillin and cephalosporin and even monobactam, entire class of drugs is having one and only mechanism. So even the mechanism is similar for penicillin and cephalosporin, all those case. But I have for started with penicillin. That's the reason I have make a title as a penicillin. Okay. So what is a simple mechanism means nothing but it's going to interrupt the cell wall synthesis, bacterial cell wall synthesis. So it's going to interfere the biosynthesis of bacterial cell wall. That's a single line mechanism. If you don't want try to make more, otherwise if you have doubt, if you can't clear means at least you can memorize this single line. Entire beta-lactam antibiotics, even it's a penicillin, whatever it is, whatever the case, whatever drug, it comes under beta-lactam ring means you simply blindly you can write it's going to inhibit the cell wall synthesis. The single line is enough. Even if you want more deeper, what is exactly going to happen? How is going to inhibit the cell wall synthesis means you can go through the some more deeper points. That thing is I can explain in the next slides. So once, what is the scenario? Once the biosynthesis cell wall, we know that the cell wall is act a compound for our house, otherwise compound, whatever it is. So once this cell wall is going to damage, otherwise the cell wall is not at all formed is very well means what's happen automatically, the cell wall is weakened. So that case, the extracellular constituents, one cell wall is going to breakage or weaken means what's happened. So the extracellular constituents easily come out into the intracellular. The same time, intracellular constituents also it may enter in, exit into the cell. So because of this phenomena, the cell is easily going to die. That's a scenario. Okay. Once they weaken the cell wall, what's happened due to the osmotic pressure, the intracellular and extracellular constituents are is going to moving from the different side. So it's lead to cell death. So spectrum wise, I already say that in basics chemotherapy chapter, based upon the viable against the organism, our drugs has been classified into narrow spectrum and broad spectrum. That means your drug is very effective against single group of organism, otherwise single organism, otherwise any specific group of organism means it is called as narrow spectrum antibiotics. It is to act only on gram positive, otherwise is going to acting on only gram negative, otherwise is going to acting on only on rod shaped gram positive. Otherwise, it's going to act on only on any specific organism. E. coli means if this drugs comes under this category means it's a narrow spectrum. Our penicillin drugs, entire class of drugs is some of the drugs comes under the narrow spectrum and some of the drugs comes under the broad spectrum. But naturally, normal the first invented or first identified penicillins are it's a narrow spectrum antibiotics. It's very effective against only on gram positive organism. In later in semisynthetic drugs are they are converted into the more potent, so it may act on the both gram positive and gram negative. But the natural penicillins are first identified innovative penicillins are very effective against not very effective. It's active against only on gram positive organism. Okay, so then next, how do they work? So we said that's exactly mechanism. In last slide we have seen it simply is going to inhibit the cell wall synthesizing of cell wall synthesis. That's the thing. So if you want more and more some more information about this mechanism, how it's exactly going to happen means this is the concept. It's a antibiotics, the beta-lactam antibiotics is going to bind with penicillin binding protein. Simply it's called as PBP, penicillin binding protein. So what is the role of this penicillin binding protein means this enzyme is responsible for the cross linkage of peptidoglycogen. We know that the cell walls are made up of peptidoglycogen. So that cell wall linkage is happened by the some of the specific enzymes. That enzyme is called as penicillin binding protein. Our drug, the penicillins, is going to attack that protein. So because of that, the peptidoglycogen is not going to cross link well. So that's the reason the cell wall synthesis is going to interrupt. It's lead to cell wall is become weak. It's lead to cell death. That's a scenario. So lack of BBB, the cross linkage of peptidoglycogen is going to failure. So once it's failure means cell wall synthesis also is going to failure. Easily suffering from the osmotic process, cell is going to die. That's a mechanism. You can see here, this is a simple picture to represent the mechanism. So this is a gram positive organism, this is a gram negative organism. Why it's the natural penicillins are very effective against only on gram positive means the gram positive organism, it's having a thick cell wall. At the same time that the thick cell wall, it's made up of multiple number of peptidoglycogen, otherwise enormous amount of peptidoglycogen. So the peptidoglycogen is going to cross link with each and every one molecule. So it's become a very tight bond. So our drug is going to bind with the exactly that PBP, penicillin binding protein. So it's the cross linkage is going to affect. So you can see here, this is a substance is going to bind with the peptidoglycogen layer, penicillin binding protein here. So it's lead to weaken the cell wall. So it's weaken the cell wall, it's lead to cell lysis. So in natural penicillins, it doesn't going to act on the gram negative molecules because here the peptidoglycogen layer is very less when compared to gram positive, they're very less. And apart from that, through the porins molecule in here in gram negative molecule in cell membrane cell wall layer, it's having aqueous pores, small pores. So through that pores, the penicillin can't able to transport. That's a reason it's very effective against the gram negative. Okay, that's a mechanism. So you can see here, this is the enzyme, penicillin binding protein. The enzyme name is transpeptidase enzyme. The enzyme name is transpeptidase enzyme. So these are the this enzyme is responsible for the cross linkage of peptidoglycogen. You just imagine this is one molecule, this is one molecule. Both the molecule is going to tie together. The same picture is here. The both molecules is going to link together or conjoin together with the help of transpeptidase enzyme. Our penicillin drugs are beta-lactam antibiotics is going to inhibit that enzyme, transpeptidase enzyme. So once if it is blocked means automatically the cross linkage is going to failure, cell wall is going to fail to, so this is a very strengthened cell wall, so weakening cell death. That's a mechanism. The same mechanisms explains a different picture here. So that's a mechanism. The next one is resistance. Normally, here in title I have mentioned is ampicillin resistance. Not only ampicillin, in most of the antibiotics, when you have taken continuously or improper way, improper prescription case, otherwise frequent usage of antibiotics in short term course, means that time the organism is make into more power. That means simply it's going to resist against the particular drugs, yeah, whatever it is, either not only penicillin case, if any antibiotics, it's comes under the resistance against the organism. That means the organism is become more vulnerable, that means more sensitive with the drug because of improper usage of antibiotics. So in this case here, how the resistance is happen means, the first one is the organism itself, it's know the mechanism which way we are going to affect. So it's read out the mechanism. So it's going to release the one separate substance. That means it's going to release on a specific enzyme. That enzyme is called as beta-lactamase enzyme. So the name itself is going to denote the mechanism. So the organism, when it's going to expose, continuously expose with the that antibiotics, penicillin antibiotics, it's know the mechanism. So it's going to read out the concept. It's going to secrete a new enzyme. That enzyme is what's doing, it's exactly is going to break the beta-lactam ring. So we know that already. The beta-lactam ring is very, very essential for the activity of beta and entire beta-lactam antibiotics, whatever it is, penicillin or cephalosporin. So those enzyme, the bacteria is going to release one specific enzyme. That enzyme is called as beta-lactamase enzyme. That enzymes, it's responsible for breakdown of the beta-lactam ring. So once the beta-lactam ring is going to cleave, means automatically the penicillins R is going to lose the efficacy. So once you lose the efficacy, means the organism is never going to, it's never going to die. So that's a concept. It's survival mechanism. So the organism is become more and more potent so against the some specific antibiotics. So that's a scenario here. Beta-lactamase enzymes. So how we can overcome this problem means, so once we have to discover the new drug, even it is very effective against the beta-lactamase enzymes also. That is another one case. We have to discover, otherwise we have to innovate some new class of drugs. It's very effective against the particular organism, and also it's effective against, it's release the substance, that's mean degrading substance, beta-lactamase. So beta-lactamase resistant antibiotics we must to create. Otherwise we have to go for, otherwise we have to find the enzyme inhibitor, the particularly the beta-lactamase enzyme inhibitor. So I can explain the next slide. So that's a scenario. So the beta-lactam antibiotics, entire class of antibiotics, it's a time dependent killers. That means based upon the MAC value and how much time concentration, plasma concentration, based upon that it's produce the efficacy. Either it's a bactericidal or bacteriostatic effect. So the penicillinase or beta-lactamase, I said the beta-lactamase, it's an enzyme, it's responsible for the breakdown of beta-lactam ring. The beta-lactam enzymes, lactamase enzymes, otherwise is called as penicillinase enzyme. So we have to found these specific drugs against those enzymes. So nothing but before that we have go see these some basic concepts. Why it's called as time dependent manner means, I hope in your second year pharmacology 2 itself, you know the what is plasma curve and AUC curve and minimum inhibitory level and maximum effective concentration or minimal toxic concentration, all those things you know that. So I don't want to explain much more in this slide. So you can see there, when the drug profile, when in plasma concentration, when the drug is going to reach the onset of action, that means reach the MIC value, minimum inhibitory concentration value, that case only it started to produce the activity. That means that case only it's going to kill the organism. So when the plasma concentration is going to reduce after administration of drug, after 10 hours or 12 hours or 18 hours, whatever it is, during the time duration based upon the plasma half-life value, when the plasma concentration level is less than the MIC value, it's going to lose the efficacy. That's a duration of the onset and end of action is called as duration of action. So the based upon the duration of action only we can say the efficacy of the drug for in this case. So then I want to give some basic adverse effects of the penicillin. So we know that penicillin is actually it's a fungal product. We know that it is discovered from the Penicillium notatum and chrysogenum. So it's actually it's a fungal. So we have taken the fungal product to eradicate the microbes. That's the reason it's called as antibiotics. We get the product from the biological organism. That means fungus. The same product is going to active against the another one biological substance. That means here bacteria. So it's a fungal product. So whatever it is, if it's fungal product means definitely even it may cause allergic reaction. That is one of the major things. So it may produce hypersensitive reaction, otherwise severe allergic reactions. So apart from that, there is some of the first three things is very common one. GA effects. As usual, you can write nausea, vomiting, diarrhea, abdominal pain, gastritis, all those things is common. So another one in GAT, another one thing is major thing is diarrhea. So what's the reason for diarrhea means? It may produce the super infection. That means it's going to affect the eradicate the intestinal bacteria. In our intestinal, it's having a microflora. It's having a number of organism. It's a beneficial organism. It's considered as a beneficial organism. Those organism is going to synthesize some of the essential product for our normal physiological work. So whenever you have take these antibiotics, it may affect the intestinal floral beneficial bacteria also. Particularly the intestinal microflora, it's responsible for the production of vitamin K. When it's going to eradicate, it may cause the diarrhea. That's a reason. Then as usual, it's a fungal product. If you administer through the even parenteral or oral case, it may produce the allergic reactions like rashes, pruritus. Nothing is everything is a skin rash, like skin irritation. In some cases produce fever, and articulate itching sensation may be there. Then important one of the important, very very important allergic reaction is anaphylaxis. I think most of the guys, you know, the in basic general pharmacology itself, you know that what is anaphylaxis sacs. Even though I want to explain here itself, the anaphylaxis sac is nothing but the both cardio and respiratory arrest means it is called as anaphylactic shock. So when you have take this penicillin, we know that it's allergic substance. It's a fungal product. So if you take means that time, if it is allergy with your body means immediately it's going to mast cell is going to destruction. Mast cell is going to destruction. We know that what is containing in mast cells. So mast cells is containing enormous amount of allergic mediator, that is histamines. So the histamine is going to release. It started to produce the allergic reactions. That's a scenario. So enormous amount of histamine is going to release means what's happening? The histaminic receptors are present on both the places. Both it's available in the bronchi and heart. Once the histamine is going to bind on the bronchi means it's produced the bronchoconstriction. So you can't able to breathe. So it's like an asthma condition. So bronchi is going to constrict. It's lead to the asthma, like asthma condition. So you can't able to breathe. That's a first scenario. Second scenario, the same histamine is going to bind with the histaminic receptors, which one is present on the heart. That case, it's going to produce the cardiac arrest. So both the condition within a fraction of minutes or fraction of minutes, it's produced both cardio and respiratory arrest. So entire blood circulation is going to stop. In that case, the patient is going to die. That is very very critical condition. So that's a reason in olden days, in because before 80s or 70s, mid of the 80s or 70s time, so only the most available antibiotics are penicillins. Those case the doctors are doing such a nice test whether they have checked whether the person is susceptible for sensitivity or not. So for this case, what they have done, before administer the full dose of penicillin, they have taken the pinch of penicillin solutions. That means 2 drops or less than 1 ml, 0.1 ml or 0.2 ml of penicillin. They have injected into the your skin region. They have marked into the particular area. They are inject the 0.1 ml of penicillin. Then they said you just wait for half an hour or 1 hour, you simply sit on the chair. So within half an hour or within 1 hour, if the person's having any allergy, means the doctors they found, okay, you are allergy with penicillins, so penicillin is not useful for you. So immediately they can give the antihistamines to resolve that allergic reactions. Then they can go for some other antibiotics. If the doctor failed to do the test, otherwise the patient say, I know already that penicillin is nothing to happen for me, I can tolerate all those things, means without testing they can inject the penicillin as a full dose. Means if the person is having allergy with penicillin, means within 30 minutes or within less than 30 minutes the person is going to anaphylactic shock, both cardio and respiratory arrest. The person get the injection, they can go to home. On the way to home, he can go into both respiratory and cardiac arrest. The patient is going to die. So many deaths has been observed because of these cases. So if it is happen, means what is the drug of choice? I think in second year pharmacology, you know that antagonism, different types of antagonism, the same example is there. So in that case, both cardio and respiratory is going to arrest. So for that case, what is the drug of choice? Means the only life-saving drug is adrenaline, because the adrenaline, it's also having a property to bind with the both the places. It's having the both the places, the lungs and the heart, both the place it's having a adrenergic receptors, both beta 1 and beta 2. Beta 2 is present on the bronchi. Once the adrenaline is going to bind, means it's going to produce the relaxation of bronchi. So the airway obstructions become resolved. The second one is the cardiac arrest. The same thing in heart, it's having a beta 1 receptor. When the adrenaline is going to bind on the beta 1 receptor, it stimulates the and contraction of the, it's increase the force, positive inotropic chronotropic effect. So it's increase the force of contraction. The heart also started to beat. So that's the only drug of choice to treat the anaphylactic shock. This is a major adverse effects events in penicillin case. So I said already, the penicillins are it's resistant by beta-lactamase enzyme, which one is secreted by the bacteria. So the resistant bacteria is going to release the beta-lactamase enzymes. So it's going to inhibit the cleave the beta-lactam ring. Through that, it's going to lose the potency. So for those case, we can use the beta-lactamase inhibitor. So apart from that, what is the therapeutic uses? Major therapeutic use of penicillin means it's useful in treatment for various wide range of effective against the organisms. So in olden days, it's used for the syphilis case and tetanus case. Okay. So this is a example for beta-lactamase inhibitor, that is clavulanic acid and sulbactam. We just memorize these two drugs because in this category the two drugs is very important, clavulanic acid and sulbactam. So this drug is called as a suicidal inhibitor. This drug is called as a suicidal inhibitor. So what this drug is exactly doing means, instead of penicillin, this drug, the clavulanic acid sulbactam, both the drug is going to attack the beta-lactamase enzyme, which one is released from the bacteria. So it's going to directly one-to-one, face-to-face is going to fight together. So this drug is going to eradicate the beta-lactamase enzyme, and at the same time the clavulanic acid also is going to demolish. So it's called a suicidal inhibitor. So it's going to bind with the beta-lactamase enzyme with covalent bond. So once the covalent bond is found, means it's indicate irreversible inhibition mechanism. So once this beta-lactamase is blocked, continuously blocked, means irreversible, means we can achieve the therapeutic effect, because when the bacteria is going to release the next beta-lactamase, that case only our penicillin is going to demolish. So up to that, it's going to produce the effect. Okay, that's the thing. Mostly it's used for the upper respiratory infection. This drug is always prescribed along with the penicillin to produce the better potentiating effect. Okay, so the next one is sulbactam. This is also comes under the same category. This is also used for some specific region, effect, particularly the diabetic foot and wound infection, tissue infections. So here I want to emphasize another one important thing is propensity. So the propensity is another one important point here. So the penicillins are eliminated through tubular secretion. It's mostly the drug is eliminated through the urine. So urine formation process, how it's going to eliminate means during tubular secretion. You know that the urine formation is having three processes: glomerular filtration, tubular secretion, and tubular reabsorption. So these penicillins are it's eliminated through tubular secretions. So we want to increase the potency, otherwise we want to increase the duration of action means we must to retain the penicillin. That's one of the important goal. How we can achieve this goal means we can prescribe the propensity. The propensity is having one of the unique property. What is done is going to combat the penicillin. Where that's a point. It's going to combat the penicillin in exactly in tubular secretion process. So what's happened instead of penicillin, propensity is going to combat it. So instead of penicillin, this propensity is going to the tubular secretions. So it's going to eliminate through urine. So we can retain the penicillin. So this is the one of the nice mechanism to retain the penicillin. From this drug, we can retain the penicillin, so we can increase the duration of action for produce better antibacterial effects. Okay, this is another one point here. So here itself I can wind up the session. So this is the overall otherwise core concept of entire beta-lactam antibiotics. Apart from that, each and every antibiotics, each and every drugs class based upon their drugs, Ambisaline, Ampicillin, Cloxacillin. So each and every drugs, it's having some unique property. So that means based upon pKa value and is effective against the particular strains. That is the major difference. But this is a common. This is a common. If you understand means you can write entire things because the mechanism is same. Only the difference is pharmacokinetic parameters and strains wise, and either it is comes under broad spectrum or narrow spectrum. Yeah, this is a case. So either it comes under the broad spectrum or narrow spectrum, otherwise it's effective against which strain, what is the therapeutic use, because each and every antibiotics is effective against some specific strains. Whether it is used for upper respiratory infection, otherwise lower respiratory infection, that's a major difference for the individual drugs. Apart from that, this is entire drugs, entire concept is common for beta-lactam antibiotics. So that's all. In next class, I will explain the individual drugs. Thank you.